Hello friends, welcome back to Complete Medical Coding. Today I'm here with the topic of pre-authorization. Let's understand the process of pre-authorization. Pre-authorization topic, it's very important, especially when you go for interviews as well as during your whole career, your entire career, you will be using this topic. Pre-authorization. What do you mean by pre-authorization? What are how to apply? I mean, how to do pre-authorization? How to do prior approvals? How to check the status of prior approvals, and then the denials. All these are the pre-auth process. Okay, so let's learn what is the concept of pre-authorization. So there are certain steps for doing pre-authorization. The first step is the request for pre-authorization. Okay, how do we request? How do we apply for a pre-authorization request? Submission by healthcare provider. That is the first step. First, you have as we are the healthcare provider. Okay, you have to do submission. You have to submit that prior auth request. Submit a pre-auth request to the insurance company before the treatment is provided. Okay, when do we submit pre-authorization request? Always it should be before the treatment. Before treatment is provided to the patient, you have to submit for the prior approval request whenever necessary. It's not necessary for all services. It depends on case-to-case basis. It depends on the place where you are working. It depends on the insurance company that you are dealing with. All these will vary. Depends on the policy of the insurance, everything. Okay. So anyway, this is the first step. You have to always submit a prior authorization request before the service is being rendered to the patient. It is typically done electronically. How to apply pre-auth request? It is typically done electronically through the insurance company's dedicated platform or through email or fax. Okay. That is as per the insurance company. Now, required information. So, while sending a pre-authorization request, what are the points that you have to keep in mind? Required information. What are the required information that you need to put while applying for a pre-auth? The healthcare provider will include the following key details in the request. What are the details that the information that you have to include in the pre-authorization request? The first one is patient information. You have to always verify whether the patient information is right, like name, age, insurance policy number. That is very important. Insurance policy number, or we'll call it as a card number or member ID number, whatever it is, that policy number should be correct. Second one, diagnosis and proposed services or supplies. Okay, so the proper diagnosis, ICD, CPT or HCPC, whatever services are going to carry out, you have to check whether everything is correct or wrong. Okay, like surgery, imaging test, endoscopy, physiotherapy, etc. Yeah, mostly for these cases, prior auth is required, like for IP cases or for major surgeries. Okay, so for all these, you have to always check whether the diagnosis, services and HCPCs are included or it is correct. You have to verify everything. Then the next step is physician notes and medical reports, like lab results, imaging results, etc. If there are any lab results, there are any medical reports, the EMR, the medical record, the physician notes, everything you have to verify. So these are the first step to request for pre-authorization. So you have to verify all these and then you have to request for the prior approval. Okay, submit it through. You have to submit the prior approval through the dedicated insurance company's platform. It could be either email or fax or some electronic website, platform. Okay. Nowadays we are using only the portal, the claims portal. Email and fax is very rare nowadays. Anyway, it depends on the insurance company. Okay. Now, after submitting pre-authorization, what is the second step? The insurance company will review our prior approval. So review by the insurance company, that is the second step. Okay. So the insurance company will look for the following details. What does this insurance company look? What they will check? What all details they will check? The first one is medical necessity. The initial step that they look is the medical necessity. Whether the request that we submitted or the services that we are going to give to the patient that we had applied for the pre-auth is medically necessary or not. So the insurer evaluates whether the treatment is required based on the patient's diagnosis. DX means diagnosis. Okay. If the procedure is not considered medically necessary, it will get rejected. So based on whatever we had submitted, like based on the diagnosis, based on the physician notes, the services that we have applied is medically necessary. If it is medically necessary, then they will immediately approve. If it is not medically necessary, they will reject. They have the right to deny the request. Okay. Now policy coverage. Policy coverage is the next step that the insurance company will check into. The insurer checks whether the treatment is part of the policy's covered services, as certain treatments might be excluded under the policy terms and conditions. So the coverage, like for example, endoscopy. If we are submitting endoscopy, the insurance company will check whether the endoscopy procedure is covered in the patient's policy. So that policy, because usually some exclusions will be there. So they will always check whether the submitted request is part of the policy coverage. Okay. Cost evaluation. If the proposed treatment is expensive, the insurer will assess whether it is cost effective or if alternatives could be used that are more affordable or equally effective. So the next step is cost evaluation. So like for example, if we are submitting some service with like for example a profile, some profile that we are submitting, and that costs more. Okay. And then the insurance company is cross-checking whether there is any same test which can be alternate to the requested service, so that they can reduce the cost. So like that cost evaluation also they will check. So if the cost is if the cost varies, like if there's a huge difference in the cost, then of course they will request us to send back another request saying alternative service should have been utilized. Like we have to submit again with another service, another alternative service according to the cost. So that is an important point that the insurance company will check. Of course, everything is business, right? So they also will focus on where to reduce the cost. So cost evaluation is also important. Now, network providers. The treatment must be carried out within the specific network of approved healthcare providers. If the treatment requested is at a non-network facility, then the claim will be denied. Yeah, of course, this is also an important point. Network providers, because not all providers are covered in the insurance, right? For a specific insurance company, a group of providers, particular providers are only included. So the insurance will check whether this hospital or this facility is included in our policy, is included in the insurance company's policy, I mean in the insurance company's coverage. Then they will approve. If that provider is not a part of the network, if the provider is not a part of the insurance company, then definitely they will deny the claim. Okay, so these are the important points that the insurance company will review before sending a pre-auth, before processing the claim. Okay. Now, what is the third step? The third step is the insurance company is giving either approval or denial. Either they will approve the request based on the services that we have sent, or else they will deny the request. So if it is an approval, what all they will check and what are the points that we need to check while getting the approval request. Okay. So if it is approved, if the treatment is medically necessary, the insurer will issue an approval for pre-auth request. The approval document usually contains the following details. So if it is medically necessary, for sure the insurance company will send an approval request. And what are the approval document contains? We have to check whether these are included in the approval request. Okay. First one is approved services and diagnosis. What are the services and diagnosis which are approved? You have to check that. Maximum allowable cost. Whether we had submitted some amount, for example, $100, and then they had approved either $100 or maybe less than that, $80 or whatever it is. So you have to check what is the maximum allowable cost, what is the maximum approved amount. Okay. Now, third one, any restrictions or conditions. For example, certain limits on number of sessions or duration of treatment. If, for example, if we are submitting some physiotherapy session request, for example, if we are submitting like 10 physiotherapy sessions, request for 10 physiotherapy sessions, and they had approved only, say 8, 2 are denied, saying the maximum limit is being utilized by the patient. So it means the maximum limit for the, or the maximum coverage for the physiotherapy session is 8. The 2 is denied. So you have to always check that, whether if there is any conditions, any restrictions on the number of sessions or any limits. Okay. This number of sessions or the limit of the treatment usually comes for dental, optical, this physiotherapy, all these cases, maternity, everything. For that, everything there will be some restrictions, some amount is being fixed. So if the cost is more than that fixed amount, then of course that remaining balance amount should be paid by the patient. Okay, they will allow only up to that limit. Now, so we have to check for that also. Now, fourth one is start date and expiration date. When is the start date of the approval and when is the expiry date of the approval? For example, some surgery that needs to be, for the surgery and all, usually we will take prior authorization, like maybe 2 or 3 days before, sometimes 1 week before. So it varies on what the procedure is. So whatever is the start date of the approval and when is the expiry date, so you have to check always that, because within that expiry date, the provider has to bill the claim. Okay. Otherwise, if we bill the claim after the expiration date, of course, the insurance company will reject the claim. Now, the last one and the important one is authorization number or authorization code. Always check for the authorization number, pre-auth approval code. That is important. Okay. So these are the steps for approval if the company insurance is approving the request. Now, what if it is a denial? What if it is a denial? What are the things that we need to check? If the insurer deems the treatment unnecessary or outside the scope of the policy, they will deny the request. Okay. Like if it is not medically necessary, for sure they will deny the request. The insurer must provide a reason for the denial, such as, if it's a denial request, you have to check for these following, these details, like why the claim has been denied or what is the reason for the denial. You have to check for that. Lack of medical necessity, first thing, you have to check whether if there is any lack of medical necessity. Second one, the treatment is excluded from the insurance policy. If a denial comes like the treatment is excluded from the insurance policy, then you have to check always the insurance policy, whether the treatment is included in that policy or not. Now, the requested treatment exceeds the coverage limits. Yeah, as I told you earlier, the limit is important. If the limit exceeded, then of course the insurance company will deny the claim. Enquiry for additional information or clarifications. If some information is mismatched or if some information is incorrect, or if they need some additional information, then you have to, then they will deny the request. Then we have to send the, whatever additional information they have asked, we have to send it again. So these are the 4 things you have to check when the claim is denied. Now, appeals. What if a claim is denied? If the request is denied, the provider has the option to appeal the decision by resubmitting with additional information and clarifying the necessity of the service. So if the request is denied, the provider has to appeal the request by resubmitting. For example, some additional information or something, or the policy number is incorrect or whatever it is, you have to send a resubmission. You have to resubmit the claim with whatever necessary information they have asked. Okay. So these are the steps for the prior authorization. Okay, starting from approval request till the denial. Starting from applying for the approval request till the insurance company processing the claim, checking for approval, whether it is needs to be approved or denied. Okay, so these are few important points. These are some important steps from while taking pre-authorization request. So be careful with all these things, all these necessary things, and then and then submit the prior authorization request. These are very important when you in your entire career. So that's it for today, and let's come back again in the next episode with the denials. I'll be coming back again with pre-auth denials. What are the different types of denials and the codes of denials that we will be discussing in the next episode. So stay tuned, friends. If you are new to the channel, please subscribe. And thank you so much for all of your support. And yeah, stay tuned, friends. Bye. Take care.